everyone. My name is Dr. Anahita Ali, and on behalf of the Faculty of Health Sciences, James Lane Institute, Switzerland, I welcome you all in this panel discussion, rather a virtual panel discussion on World Breastfeeding Week 2025 and its theme. So I think let's start without wasting much time because our students and participants, basically they will keep joining during the session. So let's start this discussion. Every year from August 1st to 7th, the entire world comes together to recognize, support, and promote the importance of breastfeeding, which is not just a personal choice of any woman, but it is a global health priority. And for this year, 2025, the theme for this week is prioritize breastfeeding, create sustainable support systems. And this reminds us that breastfeeding is not just a responsibility of mothers alone, rather, it's a shared commitment across communities, workplaces, healthcare systems, and even governments. Today, we are honored to have such a diverse gathering for this panel discussion, including our panelists, basically experts from different parts of the world, educators, and our students. So let us take this moment to acknowledge the strength, resilience, and dedication of breastfeeding mothers around the world. With this, first of all, I welcome our panelists for this discussion, Mr. Lavalesini Negondini. Please spare me for incorrect pronunciation, who is a nutritionist and an epidemiologist from South Africa. Dr. Latika Nath Sinha, who is a pediatrician and an epidemiologist from India. And Dr. Taiba, who is from London and carries strong foundation in clinical practice and advanced expertise in public health. So thank you, a big thank you to all our panelists for accepting our invitation and for taking part in this panel discussion. So to initiate this discussion, let's start with the basics of breastfeeding and the role of breastfeeding in shaping long-term health outcomes. So I'll come to Mr. Negondeni, who is a nutritionist, and I would like to ask this question to him: that how, as a nutritionist, how do you see the role of breastfeeding in shaping long-term health outcomes, both for mothers and infants?
Thank you, Dr. Ali, for the opportunity. Breastfeeding plays a very, very important role in shaping long-term health outcomes for both infants and mothers. In what ways? It plays a very much foundational and important role because it provides optimal nutrition that is just tailored to infants' development needs. And it strengthens the immune system and reduces a lot of risk of certain diseases, for instance, such as asthma, respiratory infections, obesity, and diabetes. And that information, it's the information that is evidence-based. That breastfeeding plays a very much important role, and also with cognitive development of infants. And for mothers, it also plays a very much important role in lowering the risk of breast and ovarian cancers. And also it supports the postpartum recovery. The other things that are also important is that with regard to public health strategies that we can implement to improve sustainable breastfeeding, and also to improve equity and cultural consideration, is that we need to have systems in place from national departments to protect. They need to protect and support breastfeeding by implementing breastfeeding policies, and also implementing the international code of breastfeeding by regulating digital marketing of breast milk substitutes, and also making sure that we have strategies in place that are cultural sensitive, and also ensuring that we have community-based programs such as peer support for mothers, and also developing community support groups for mothers, where mothers can encourage each other emotionally and physically to implement breastfeeding. Thank you.
Right. Thank you. Thank you, Mr. Negundin. Now, I would like to ask from Dr. Latika Nath, who is a pediatrician, and I would like to know her perspective as a pediatrician. What are the common challenges that new mothers face with breastfeeding, and how can healthcare providers and public health practitioners can support families and also those mothers, new mothers, to ensure exclusive breastfeeding in the first 6 months, because we see that in many countries exclusive breastfeeding in itself is a major problem. So what do you think?
Good evening, everybody. Thank you to Dr. Hannah for the opportunity. And as a pediatrician, I would like to say there are many challenges for a young mother.
Sorry, ma'am, you are not audible.
I have unmuted myself. I'm not audible.
Yeah, now you are.
Okay. So one of the first things which, at least in countries like India, and I'm sure many other countries, the young mothers are not so very well aware of the importance of breastfeeding. Even though many systems and many programs are in place, their family influence and the influence of other elders in the family, elder mothers or maybe mother-in-laws, mothers, etc., plays a very important role. What we have seen is that they delay the initiation of breastfeeding and sometimes give prenatal feeds. That is before the initiation of breastfeeding. Something or the other is given, like honey or a sip of tea, or what we jaggery, etc., which is actually not at all recommended or necessary. The other thing is that in many parts of our country, there are certain myths about the first milk, that is the colostrum, and that is actually discarded in many communities and many ethnic groups. And that is actually known as liquid gold. It is the most precious part of the first 3 days. That is what is, that's what the child will, that's what the baby will get if the mother feeds. And that is filled with macrophages and lysozymes and lactoferrin, all the good things which would increase the baby's immunity. But unfortunately, it is discarded because of lack of knowledge or lack of awareness and myths associated with it, that this is like, a cow's milk. So there are certain myths involved in this. The third thing is there is a problem, initiation, because of, the latching not happening. That is, the mother is not aware positioning of the baby or the they the right way to make baby suckle with the nipple and the areola inside the mouth and the correct positioning of the baby. So these are certain things which can be overcome by just demonstrating or these techniques or just having something some people like counselors or lactation consultants, and this would go a long way in you know in both hospital and home deliveries, and that definitely hospital deliveries where today there are special programs where in each hospital, mostly the public health system, there are baby-friendly hospital initiatives which had been recommended by both WHO and UNICEF to make every hospital baby-friendly. That would mean all these guidelines being available in written and in action. So there are many counselors and practitioner specialists who would support the new mother. The next thing is that once she learns how to breastfeed, many times there are due to stress, postpartum stress, or depression or whatever, there may be some feeding problems, and she starts kind of giving up on feeding the baby, which is also very wrong. And I think she needs the maximum support from her family. She is at home, and family support certainly becomes is very very important in this because the more you support her, the more you let her be stress free, the more you let her have her time with the baby. That that is what enhances breast milk excretion. And some of them twin pregnancies, pregnancies. Then also there are that others don't know how to, alternate to the baby on the breast. So they feel that it's not enough, they're not having adequate milk for both babies or the triplets, etc. So that again requires special supportive care and counseling. That no every mother is God gifted to have enough milk for each baby, and she should know how to breastfeed from one breast and alternate the other one, and generally have these counseling sessions. Then I would just say that you know uh, many times in hot weather, which we see in desert areas or challenging climates, they tend to give water or to give any other liquid like this. They don't understand the importance of exclusive breastfeeding. So exclusive breastfeeding actually is to make them aware that all the nutrients and the water that is required is already present in breast milk, and they don't require any additional source. So I would say that all this can be overcome by, as I said earlier, good counselors, good lactation specialists, each healthcare worker supporting breastfeeding and supporting a new mother, and of course, full family support, right from the husband to everybody in the family. That goes a long way in enhancing the breastfeeding phase of her life.
That's right, ma'am. Thank you. Um, Coming to Dr. Taiba, so as you're practicing public health in London, so what are your thoughts on public health systems? How can public health systems of any country strengthen policies and community-based interventions so that we can support, promote breastfeeding, especially for vulnerable populations or undeserved areas?
Yeah, thank you so much, Anita. I just wanted to clear this one that breastfeeding is like the two-way procedure. Like it's beneficial for not for the kid as well, but for the mother as well, because this is the first food the baby is going to be get. So not only physically point of view, you're gonna be giving up baby as support, but that is gonna be a fact for the mental support as well, the social support. Majority of the misconception which I have seen in not only the underdeveloped countries but here as well, that there are some people who having a concept regarding that there are all the infections with which the mother is going to be suffered, they are going to be transferred through the mother feed or the breastfeed. No, it's not. There are some infections, or you can say some viruses, that can be transferred, but not all. The particularly one, you can say like the HIV, or you can say the CMV, the cytomegalovirus, they can be transferred, but not all. If you will take an example of like the COVID-19 timings, people used to ask us like, can we continue breastfeeding? Yes, they can, because the baby need it as well. The thing that what they have to do is taking the precautions for their hygiene and like the touching everything, but the continued breastfeeding is beneficial for the mother as well, the baby as well. So these are the major things that people think about them, and there is need to give them education for their like bounding. That's it. Thank you.
Right. So when we talk about maternity leaves in the workplaces or baby-friendly hospitals, so what do you think? Are such interventions effective?
Yes, true. True. It's true, because when you talk about like the women who is going to give like their first birth, they need time because they feel difficulty to make up bonding with their new baby. So for that particularly diabetics, they need a complete gap from their work so they can concentrate, and the concentrate include like making a bonding with that through the breastfeeding for the proper nutrition, so that that can reduce this breastfeeding can also reduce the postpartum depression as well, because that is making a complete relationship. The mother is getting a complete time to take like with their babies. So yes, that is very effective. And in this UK, they used to prefer it, and they used to like consider it important that the mother should have a complete their own time with their baby.
Right. Thank you.
Thank you.
Coming to Mr. Negundin, um, um, if we say that breastfeeding is often considered as the most sustainable form for infant nutrition for their food, so how breastfeeding contributes to environmental sustainability? If we look at the theme for this year, when we say sustainable support systems, and also the environmental sustainability. So, what do you think? How breastfeeding can contribute to this?
Thank you, Dr. Ali. Breastfeeding, it's the most sustainable form of infant nutrition. So it doesn't need to be produced anywhere using nurseries. It doesn't need to be bottled in bottles. It doesn't need to be kept in containers. So it's a natural food that is really available and that is within a mother. So it also doesn't require any packaging, transportation, and industrial processing. So that being said, it means that it significantly reduces the waste and the carbon emissions compared to formula feeding. So that's how it contributes to sustainable environment and climate resilience. So because if we're talking about the transportation, the industries, all these old things, we involve the fuel that is being used. There are so many processing that are emitting the carbons to the space, so contributing also to global warming and also the air pollution. So with breastfeeding, a woman just have to take a breast and feed the baby. That's it doesn't contribute to global warming. So it is important for us to. So when we promote and protect breastfeeding, we are helping to mitigate the environmental toll that is being placed by formula production and disposal. So again, I think it is also important to to raise awareness or create awareness by integrating sustainability messaging into campaigns that are protecting and promoting breastfeeding. And we can do this by regulating digital marketing, because we can see that in today's age, there's TikToks, there are TikTok doctors, a lot of nutritionists, a lot of dietitians. There's a lot of information that is related to digital marketing where people market breast milk substitutes. So it's important that as health professionals and also the community at large, we protect breastfeeding by also raising awareness on how it contributes to climate, breastfeeding contributes to climate resilience. And lastly, I think it's also important to indicate that to build sustainable support systems such as BFHs or baby-friendly hospitals and workplace policies that ensures that breastfeeding remains a viable and eco-friendly choice for families. Thank you.
Right. So do you agree if we say that there are eco-friendly benefits of breastfeeding?
Come again, Doc?
Yeah. So will you agree if I say that there are eco-friendly benefits of breastfeeding?
I don't know whether it's my connection. There are what benefits for?
Eco-friendly breastfeeding or eco-friendly benefits of breastfeeding. Can we say this?
Definitely, yes. Yes, yes. Definitely.
All right. Okay. Thank you. So, as our nutritionist, Mr. Negandin, said, the eco-friendly benefits of breastfeeding related to the environment and the climate change. So, coming to our pediatrician, Dr. Latika, I would like to know your thoughts on the sustainable practices that healthcare systems and communities can go with to provide such support for breastfeeding and rather make it eco-friendly.
Right. So there are many initiatives coming from international organizations, WHO and UNICEF, who have the kind of release the standard operating campaigns that you can do. One of the things which are let you know that this entire week there are a lot of community events and with mothers or to be mothers, again telling them about the benefits of breastfeeding and also to kind of encourage them to continue breastfeeding right up to 2 years of age and definitely exclusive breastfeeding till 6 months and then to start complementary feeding at 6 months but can go on to 2 years. So there are specific programs, and I'm sure there must be many such in every country. In our country, like in India, we have something called Mother's Absolute Affection, where there are a lot of information, education, communication materials, again through social media and as you said, digital sources, telling and counseling mothers about the benefits of breastfeeding through animation or through role plays or through small scripted, small role plays. That helps, and the access to these on the social media also helps mothers to kind of see them and get inspired and to go through breastfeeding when they give birth. The other thing is the formation of peer groups. That is, the best person to counsel another mother is a mother who has gone through this experience. And the formation of these peer groups, if that is done at the hospital level or community level, that would go a long way in supporting new mothers. So I would say that every village, every unit, every family, or even every if possible, every at least every village should have some kind of a peer group support where women who have gone through this phase are able to counsel the younger mothers on the benefits of breastfeeding and whatever problems they face, they can tell them in their own, that has the maximum impact. That is peer group. The third thing is emphasizing on the nutrition of the mother. So we have campaigns on nutrition where, because of the special phase of life and the additional calories that are required by the mother, which is actually 600 kilocalories in the first 6 months of lactation and around 520 in the next 6 months. So for 1 year, she has to undergo this special phase in her life, and she needs those extra calories. So whereas she needs that advice on how to increase her nutrition to be able to meet the needs of this breastfeeding phase. In that, they are advised special recipes or special nutrient containing recipes which enhance this, not enhance breastfeeding, but give her the right calories, give her the right vitamins and minerals, which will then go through the breast milk in her infant. So this is very important. Nutritional support, nutritional advice, and this is what India is doing through their big campaign called Poshan Abhiyan, where they are encouraged to go through these kind of recipes, and the household members are also kind of viewing these things through social media, etc., to be able to give and provide it to the new mother. Then there is a home-based postnatal care program where there are field health workers and frontline workers going to the houses of a newborn, a mother with a newborn, and seeing whether she is actually breastfeeding, whether there are any problems, if supposing she's having some inverted nipple or breast ulcers or sore nipples, then how to advise her what she can do about it. Like she can rub her own breast on it. That is the best healer. So these kind of postnatal care that can be provided home-based, that is also goes a long way in promoting breastfeeding. The rest, I would just say that yes, if everybody gets involved, that is, as we talked about workplace, any mothers have to, although there are a lot of guidelines and legislations on at least 6 months maternity with so that she can breastfeed for post-delivery breastfeed for at least 6 months exclusively. The knowledge on using express breast milk for a working mother, that is very important. People don't realize, and they resort to animal milk through bottle feeds or through formula, infant formula is available. That has to be discouraged, and express breast milk has to be encouraged. So one of the initiatives in India are that there are milk banks now. So milk banks means any woman who is lactating is able to express her breast milk and store it for the use of those babies who have lost their mothers or have sick mothers, or they are the mothers who are not able to breastfeed. But even educating a mother on expressing her breast milk and storing it in the right way, and using the other caregiver using that breast milk for the baby. Well, if she is working and is at her work. So this knowledge of exclusive breastfeeding and using of after 6 months using express breast milk, that has to be advocated properly. My last point is, at the work, having exclusive breastfeeding corners or creches where she can breastfeed in peace and in privacy, that has to be encouraged in public places, workplaces, airports, railway stations, bus stands, so that everybody knows and respects a woman who has to breastfeed her child, and they are able to provide a space for her to do so. Where the culture is such that we are slightly, the mothers are shy and they are not so comfortable in public place. So these are my points for all the support systems and all the programs that can be done or should be in place to enhance the culture of.
Thank you, ma'am. Thank you for sharing all these points. Um, Coming to Dr. Taiba, can you also suggest such sustainable practices that healthcare systems and communities can go with to provide the ongoing support to the mothers, to the breastfeeding mothers, and also we also have to make such practices more sustainable. So what are your thoughts on this?
As ma'am said that it's the mother who are just newly became a mother, they think that it's very fearful or it could be painful to breastfeed their new babies. So particularly we have to focus that point that it's not painful, and that can be helpful, or you can say that you can eliminate that particularly thought from their mind with the help of family. But not family is available everywhere, family support is not available everywhere. So if you will see that in UK there is a big budget is being devoted for midwives who make sure that okay, these are the newly moms, and how they have to teach them that how they can breastfeed their kids and how they have to handle them for that particular time. They have to make sure that if they are breastfeeding their kids, their nutritional needs should have to be fulfilled, because they have to feed their kids, but there is particularly they have to need to feed as well themselves. So yes, this is very important to be supported by family. And if there is not family, so the outside the family, like the midwives or the nurses, they should have to teach them what is the proper way to mother feed, so that it would not be particularly painful in future. Yeah, this is very point from my point of view, this is very important to educate women. It's not painful, and you have to make sure that proper positioning and proper way you can deliver that one in a good way.
That's right. Thank you for sharing your thoughts. Coming to our nutritionist, Mr. Negonden, um, what, or I would say, which one actionable step, um, whether as an individual or as professional or as policymaker, what actionable step uh, they can take to create more supportive, sustainable environments for breastfeeding?
Thank you, Dr. Ali. Given the importance of breastfeeding to both mothers, the infants, and the environment, I think what could be a takeaway or an actionable step that we can do to advocate for breastfeeding is to implement workplace breastfeeding policies. That will, because the today's in today's age, there are so many challenges that breastfeeding mothers are facing, including the busy schedules. So we need to make sure that we provide time, we provide space, and support mothers who are breastfeeding, whether as individuals, professionals, or policymakers. We need to ensure that we create those enabling environments, such as lactation rooms or in work, and ensure that we create awareness for employers to have flexible schedules or breastfeeding hours for mothers who are working, and also to have things such as the paid maternity leave to support so that mothers can have enough time to support to breastfeed their infants, because breastfeeding it's really not an easy task, considering that the challenges that women have to go to work, they are busy, so they need all the support that we can do. And as a community at large, so that they can rest, they can have enough time to bond with their babies and also to breastfeed their children. Because the more they are stressed, it makes their breast milk not to come out easily. So, but the more they rest, then they are able to breastfeed and more breast milk comes out. So, creating the flexible schedules and paid maternity leaves, so it will empower them to continue breastfeeding. And also, as individuals, professionals, and policymakers, we have someone at home or at the community, or a sister or a cousin who is breastfeeding or who will at some point breastfeed. So it's important that we support them uh, emotionally and physically in whatever ways we can support them, to ensure that they breastfeed. And also, when they're breastfeeding, they are not only benefiting only their babies or themselves, as we have already mentioned that breastfeeding also help mothers to with ovarian cancer and also postpartum recovery, and such as losing the uh, weight that they gained during pregnancy. So yeah, the advice is that let's look at those whole system from the policy point of view. As professionals, let's advocate that there are policies that are catering for women, for mothers who are breastfeeding, and at community level, those that are at the ground, let's make sure that we capacitate them to train them in issues of breastfeeding, so that people such as community health workers and nurses who are working with breastfeeding mothers, they will know what to do, how to support women who, or mothers who are breastfeeding. And also, families, it's important to create enough awareness at community level to ensure that the community at large knows the benefits of breastfeeding, from the mothers to the benefits of mothers to babies to the environment. If we create that awareness, then the breastfeeding coverage will also increase globally. Thank you so much.
That's right. Thank you so much. So before we conclude this discussion, anyone from the audience, I would like to invite anyone from the audience. If you want to share your own personal experience, or if you have any questions from our experts. Anyone from our audience, please feel free to connect with our experts, to if you have any questions, any queries, or if you would like to share your own experience.
Yes, thank you very much for the opportunity. I'm Leo Alfred, a student. I thank all the panelists for the discussion. Mine is a question that I would like to understand more about the child care. How can it be a conducive environment, or how can it be sustainable? And at what period should it be started? Thank you.
Would
All
you like
right.
me to?
Yeah, ma'am, please go ahead.
Okay, I just want to say that first 42 days, that is a very important period of postnatal care. And if you really, those are the days the mother has to, right from taking care of a newborn, becoming familiar with all the aspects, how many frequency of breastfeeding, taking care of the newborn, taking care of all the things like cord care, anything, skin care of the newborn, preventing hypothermia or glycemia. This phase is the most important phase of newborn care. What it is. And to provide that, there are no, like I said, postnatal care programs, which should have regular weekly monitoring of both the mother and the baby, whether the breastfeeding is going on fine, whether there is any, whether the breastfeeding is going on fine, whether the mother is having any problems, whether the mother knows what to do, how to counter those problems which we have already discussed. So I would say that to make it sustainable, you definitely need to have somebody doing this postnatal care for 2 days, and that is in our case, we have a system where there is one ASHA, if you know, there is a kind of a social health activist, a frontline worker who visits homes and does this postnatal. I'm sure similar systems must be there in other countries too.
Okay, so let me just summarize because there were some issues with the clarity of the voice. So basically, Dr. Latika said that we need people, we need entire team to make it more sustainable. For example, there are ASHA workers in India, so they work at the ground level. They on regular basis they visit homes of the new mothers to check for the infants, their health, and
The
them
mothers,
counsel them for exclusive breastfeeding. So we need people, we need entire team to make it more sustainable, to support. If we want to create support systems, we need the support of the people who can work at ground level. So basically, in India, for example, there are ASHA workers who are specifically working in rural areas, hard to reach areas, remote areas, where they visit the houses, the homes of the new mothers who are breastfeeding to help them, to educate them. So this is what Dr. Latika wanted to say. Sorry for the inconvenience because there are some issues with the voice clarity. So anyone else, before we conclude today's discussion, anyone else would like to ask any question? All right. So, Dr. Taiba, I would like to ask for your final concluding remarks on the world breastfeeding and the theme that we discussed this evening.
Thank you, Dr. Ali. I just wanted to conclude it like that. It's a continuously support system, and there is a continuously effort we need to, as the baby delivered, we need to support the mother in educating her that how she has to breastfeed and when she has to, and make sure that she should have to be satisfied mentally, physically, and other. And for that purpose, the family can help them. If there is no family, as there is a, you told about the in India there is a organization which are supporting who don't have any family support. Meanwhile, there are other support systems that are also available, so if there is no, they are supporting them. It's very important. And one thing that I wanted to mention, there are we have encountered so many children who are suffering from the like early teeth caries, that is also particularly associated with the bottle feed. So that is important. Those children who having only mother feed, they are not suffering for such type of a problem as compared to who are taking the milk as a bottle feed. And that's it. Thank you.
Thank you so much, Dr. Taiba, for specifically highlighting this point, because I am also a dental practitioner and I understand the early teeth caries in children and infants. So yes, that is actually true. Definitely, we as public health professionals and dental public health practitioners, we should also discuss this point when we talk about making and prioritizing breastfeeding and making it sustainable. So thank you for bringing this point in this discussion. Coming to Mr. Negondin, um, I would ask for your concluding remark or your notes on today's discussion. Yeah, before he concludes, let's first take this question. How breastfeeding mothers, okay, how, throwing some light basically on breastfeeding mothers in natural disaster areas. How can we provide support to them or make it sustainable in such affected areas? Dr. Latika, can you
See,
answer
in
this question?
this kind of areas, I would say the whatever we have discussed is applicable there also. In fact, to a more, I would say, to a much greater level because of the challenges of the natural disaster. The things remain the same: peer-to-peer counseling, peer support, peer counseling, then the family support and workplace support when they go back to work. The, the guidelines, or let us say the rough support systems that are required, whether the mother is in a normal area or a natural disaster struck area, it's the same. But yes, I would say that they would require more support, and hence this can come best from peer group, best from mothers who have already been through the experience and are in their vicinity. But that is when everybody themselves is counseled on the importance of breastfeeding right from the antenatal period. Right, that is also very important. Antenatal counseling helps a lot because it primes the mother to what she will face once she delivers. So I would give a lot of stress to antenatal, that the counseling of the mother, the peers, the family members, the husband, everything should start from antenatal care. When she visits for her checkup, that emphasis that breastfeeding is a beautiful experience, a very needed experience, and has so many benefits for both the baby and the mother, that has to be engraved in her by the time she delivers. And even if she is delivering in challenging circumstances and challenging areas, the guidelines remain the same. The importance of breastfeeding remains the same. It can only be further emphasized. That's all. That's all I can say.
Right. Thank you, Dr. Latika. So coming to Mr. Negundin, are you there?
Yes, I am,
All
Doc.
right. So I would request your final concluding remarks on today's discussion and this theme for our audience.
Thank you, Dr. Ali. My concluding remarks will be that to create a sustainable breastfeeding systems, support systems, we as professionals, we need to create systems or advocate for breastfeeding, and by creating awareness, not only during the breastfeeding awareness week, we should always have campaigns that are creating awareness so that we advocate for breastfeeding. At national level, we must ensure that the policies breastfeeding policies are implemented. And also at our facilities, we must ensure that the baby, we implement a baby-friendly initiative, and ensure that the breastfeeding code of marketing breast milk substitutes, because in the digital market, that influences mothers out there. So let's make sure that we approach breastfeeding holistically, looking at the policy, looking at the at educating the community, creating awareness at community level, ensuring that people have knowledge, understand the benefits to the infants, to the mothers, and also the benefits to the environment. Then we will see the benefits in our communities. Thank you.
Great. So, for today's panel discussion, a very big thank you to our experts who joined us for this discussion and shared their expertise and knowledge. The recording of this entire discussion will be available soon on our YouTube channel. You can access it anytime, and I will soon share the link of the recording of the video. And I also thank our today's audience, for joining this discussion. So please stay in touch, and we look forward to having more such collaborations and discussions in the future as well. So thank you so much, and have a good day. Good night. Thank you.